Joining me now is our first guest. We have Dr. Henry Lemley. Good morning. How are you doing, Doctor?
Good morning, Mariah. I'm very well. Thank you for asking.
I'm happy that you are here because we're talking about something pretty serious that a lot of us like to put in the back of our mind when, you know, our days get busy. You have a specialty in helping patients with severe migraines and chronic headaches. Talk to us more about that. We've got to talk about self-care.
Sure. Well, this is Wellness Week, and I am a wellness physician. I do medical Botox, and I help people with their chronic pain problems of the face, head, and the neck.
Yeah, because I think that's where we hold a lot of our tension, in the shoulders, in the neck, and you're just like tensed up and you don't even realize it until that pain starts to set in.
It is. Nothing beats a good massage. I will say that. But for those that need constant relief that will last for months, directed botulinum toxin injections in specific places about the head, face, and neck can bring you 3 to 4 months of real pain relief.
Wow, that's incredible. I mean, you're also talking about you're using therapeutic and aesthetic treatments in your practice. I mean, how do those fit overall into wellness?
I'm so glad you asked. Wellness is something we do on any average Friday, okay? It's just living your best life. Peter Attias, who's a longevity medicine specialist, says the 4 pillars are good nutrition, good diet, good exercise, and he says emotional health, but I translate that as good company.
That's good.
Having a good social network and good friends really helps.
Yeah, because nobody wants to be around a negative Nancy all the time. I literally just said that in a story yesterday. Somebody that it's there to uplift you, point out the positives, even if you're having a rough day. That can really make all the difference as well. And you mentioned things like self-care. I was at an event earlier this week and I heard this woman share that sometimes we look at self-care, things like for a lady, if we're going to get our nails done or our hair done, we can sometimes look at that as self-care, but really that's just everyday maintenance. But we can change our minds to think, oh, this is the only time I have to do something like self-care, but you're also making sure that eating right, having good company, those are things that can translate into self-care as well.
Correct. Yeah. I spend, as a physician, as a wellness physician, I spend most of my time upstream. So I focus on labs, lifestyle, and early risk detection. I'm wanting people to live a long time and a good time. It's one thing to have a long lifespan. It's another thing entirely to have a long health span. And I'm trying to help people have long health spans as well.
Health spans we do need indeed. One thing I want to talk about that you mentioned earlier was Botox. That's something that can be misunderstood for a lot of folks. How do you as a physician use it as a medical tool?
I have several patients who I treat their migraines with Botox. I have a lady, she'll come in with 10 out of 10 pain, and she'll leave the office with 0 out of 10 pain. And there is anesthetics benefit to it. She not only leaves having no pain at all, but she looks like $1 million.
Oh my, there you go. You got a plus side there. You're feeling better and you look great. I hear that you're heading to a conference in Nashville pretty soon. What's that focus going to be about?
Thanks for bringing that up. That is March 26th and 27th. I've invited to attend a conference in Nashville. It's on advanced medical wellness and medical aesthetics. And we're looking for models. I'll need people to assist me as I learn to master botulinum injections in the face, mastering lips with dermal filler, and doing mid-face and lower face lifting with PDO lifting threads.
All right, so definitely need some models for that, but the one thing I also want to take from that is you said you're also going to be learning. So this is something that you are constantly practicing, brushing your own skills up on. It's not just we found this solution and it's going to last forever.
Every physician is a lifetime learner, and I'm no exception. It's a requirement in our specialties, and I've decided to focus on longevity, wellness, and medical aesthetics. So yes, I'm constantly learning and constantly mastering my skills, and that's why I've been invited to attend a mastery class in Nashville.
I'm sure that brings a lot of people some comfort that might be watching, and even speaking of those folks at home, I know a lot of them might be on the edge teetering a little bit, because again, we've heard about some of these things like Botox and fillers, but to know that it can be helpful for our medical well-being or health, what would you say to maybe encourage someone to tap in this sort of, treatment?
Well, I would encourage them to look at the QR code on the screen, follow me on social media, on Instagram, and if I can't help you, I can certainly direct you to someone who can. What you're looking for is a physician-led aesthetics practice. Physicians are trained in medical decision-making. We know how to mitigate risk. We know how to recognize complications as soon as they happen. I use every safety protocol. I use facial ultrasound to identify major vessels and structures. I know the anatomy like no one else, and I will ensure that you have as safe an outcome, and if there is a complication, recognizing it immediately and treating it immediately with medicines that I keep on hand.
Absolutely. Safety is first and foremost at the top of everyone's mind. We have just a few seconds, and I want to ask you first, is there someone, any type of age range, or someone that might be like, okay, if you are facing this, this may not be the treatment for you, or is anyone welcome to participate?
Anyone is welcome to participate. I can evaluate anyone and tell you why your options are. I will always give you an honest, unbiased, professional, and medical opinion.
Good. Doctor, thank you so much. This has been such an eye-opening conversation for me, and I hope for you all at home as well.